Okay, whether you're training for a marathon or, just getting some exercise in, it's so important to avoid getting hurt.
So true, Christina. Our friend, Dr. Johnston from GBMC, took me to explain the most common and extreme injuries we face when running and even walking. Check it out, guys. Hey guys, it's your girl Chardell Moore. So I'm hanging out with Dr. Jamie Johnston from GBMC Healthcare to talk about something that most of us do, running. Are you a runner?
I'm not a big runner, but I like to run in the winters when I'm not swimming or biking.
Gotcha. So I'm a runner, and the fact is, when you're a runner, you have to be careful because you can get injured, right, doctor?
That's absolutely right.
Okay, so give us the details. What is the main reason runners actually come to see you?
Okay, so we have a couple models here.
Oh,
so
I like this.
The majority of the injuries that we see are knee injuries.
Got it.
You can irritate the kneecap here or the patella. You can, because when you're running back and forth, that's irritating or rubbing. So you have what's called the trochlea. That's all cartilage. And this part's your kneecap or your patella. That's cartilage. So back and forth hundreds and thousands of times. If there's slight alignment, you can have irritation there. The other thing you can get is tendonitis. So you see the tendons here. This would be the quadricep tendon. This would be your patellar tendon. That can get irritated. And even in the areas where it's inserting into bone can be irritated. More serious injuries in the knee could be in the meniscus, which is the part in here which is serving as a cushion in your knee.
Yeah.
So a sign for that would be if you're having catching or locking or mechanical symptoms, that may be a more serious injury versus just a tendonitis or irritation.
See, that's why it's so important to stretch before you run, right?
Yeah, stretching is really important. Stretching before and probably after, and probably taking some time to warm up ahead of time. So you don't get injuries. Here's some other injuries that we see are in the back of the foot. You can't see, here's no Achilles tendon, but the Achilles tendon would come in the back, and you can imagine when you're running back and forth, stepping on your foot hundreds and thousands of times, you can get irritation there. You can even get, if you really overdo it, some people will get what are called stress fractures, where you go out and you're running 5 miles and all of a sudden you increase to 20 miles. I just saw a young woman
20 miles? Wow.
Yeah, incredible. So it was a young woman who was a cross-country runner last week who had increased as she went to college and had developed a stress fracture. So they used to call them march fractures because the guys would go out and they'd go to basic training and they'd march and they'd all of a sudden march 10, 15 miles and they develop fractures in their metatarsals. So these kind of overuse injuries are pretty common in running, and for the most part, just by backing off a little bit in your training, 10 or 20%, that should take care of most of it.
So when should we actually go see a doctor then?
That's a good question. I think for most of these injuries, they can be treated just by pulling back a little bit, by icing, by listening to your body. But if you have those mechanical symptoms, like catching or locking in your knee, or if the knee swells up, or if the pain's not getting better after several weeks, it's probably better to see a professional.
Well, thank you so much, doctor. I definitely learned a lot of information. And I like this office. This is new, right?
Yeah, this is our new office in the 7th floor of the West Pavilion here at GBMC. We're very proud of it.
Thank you so much. And where can our viewers find more info?
Say it again?
Where can our viewers find more info?
Oh, gbmc.org.
Awesome. Thank you.